I'm Paul MacPherson. I'm a clinician investigator at the Ottawa Hospital and the Ottawa Hospital Research Institute. And the study we're talking about today is the therapeutic drug monitoring for penicillin in the treatment of syphilis. So it's a pilot study 011. And the reason that this is particularly interesting is rates of syphilis are increasing across Canada, and the population most affected is HIV-positive men. So where we're seeing the highest rates of syphilis over the last decade. The problem with treating syphilis is penicillin's been used since 1943 with no clinical data to tell us what the appropriate dose and duration of treatment actually is. So everything we do is actually based simply on historical records and essentially expert opinion. We just do what's always been done. So we really have nothing to guide us. So with that in mind, we really felt that we needed some of those data. The other important issue is that if you actually look in the literature, and we see this in clinic, people who are treated for syphilis, actually about 15 to 30% of people, the penicillin actually doesn't work, and they have to come back and get treated again. So then the question then is are we dosing penicillin correctly? And perhaps if we gave more penicillin, fewer people would need to be retreated. But since we have no data, it seemed pretty obvious that we needed to start acquiring that data. So CTN was very helpful in helping us establish a pilot study to start to acquire some of the data that we would then use to design a larger treatment study. So HIV research has always been interesting to me for more reasons than we have time to go into. I trained as a researcher first, so I've been a basic scientist since university, and I actually went to medicine later in my career. It was HIV that actually drew me into medicine. I won't give away my age, but things were not good at that time, and I felt maybe I could contribute to the battle against HIV. And as I came into clinical medicine, I of course brought my years of research training with me, and it seemed like a pretty obvious marriage to bring my clinical interest in HIV and my research background to ask some questions to try and move treatment and prevention for HIV, bring all that together.